If you are wondering what's been triggering the uptick in local COVID-19 cases, experts point to the Delta variant.
News 8 Now's Tyler Joab joins us now with a closer look at the level of spread right here in our community.
Dr. Kenny from Gunderson Health System had been studying COVID-19 activity in our communities through genome sequencing. It identifies strains of the virus through someone's DNA. Dr. Kenny says he identified the first case of the Delta variant strain in our area in mid-June, and it has spread rapidly ever since. COVID-19 had felt like it went dormant in the La Crosse area for the first half of summer.
It was a pretty quiet period.
But the virus is beginning to erupt yet again. Gunderson's Dr. Kenny, who studied genome sequencing of the virus, says La Crosse County saw 133 cases last week. He says almost all the cases are coming from the Delta variant infecting unvaccinated people.
Clearly, cases are on a very strong upward curve.
Dr. Kenny says those in their 30s are seeing the biggest increase right now. Cases are surging in almost all age groups except for those 80 years and older.
And I think that's, just one more indication that the vaccines that have been deployed, where we really have strong uptake in that older age group, are working very, very well.
He says many of the first Delta cases came from people traveling here.
But the key thing is now it's here and people are spreading it very, very efficiently among themselves.
Florida is the nation's COVID hotspot right now. Less than half of the state's population is fully vaccinated.
The surge that is happening in Florida is the same surge that is going to happen in the Midwest. It's just that they're about 4 to 6 weeks ahead of us.
Dr. Kenny emphasizes that more vaccinations are the key to tone these cases down here.
So I think, for people who were on the fence in the past, thinking, gee, maybe we just don't know enough about these, we know a lot now.
That these vaccines are effective and could ensure that we don't become the virus's next epicenter. Says that his team has stopped genome sequencing for now because they ran out of grant money last month. If they were still sequencing, he tells me he is confident most of the strains identified would be Delta. He says his team will sequence again if a very large number of vaccinated people contract the virus. Mike and Amy.
All right, thank you, Tyler. Gunderson health officials tell News 8 Now COVID-19 hospitalizations at that clinic have doubled since last week. Several hospitalized patients are unvaccinated.
And Mayo Clinic health system leaders say they've also seen an uptick in COVID-19 hospitalizations.